Tell us your name and your what you're here for, please.
Hi, my name is Jill Hines, co-director of Health Freedom Louisiana. We're a consumer and human rights advocacy organization. And on March 3rd, 2021, I sent a letter to Dr. Phillips of LDH regarding our serious concerns about COVID-19 vaccine adverse events underreporting. I was receiving troubling messages from nurses working in ICUs who were seeing concerning numbers of sudden onset severe health crises amongst their patient census, but had no way to identify if these patients had been recently vaccinated or not. In the letter, I expressed concerns over stories of deaths following vaccinations that had gone unreported as well. Why, when the state tracks adult vaccinations, would healthcare professionals not be able to access vaccination history? Around April 3rd, almost a month, a little over a month after I wrote that letter, a nurse reported that vaccination history was suddenly available on the patient's electronic chart. So for 4.5 months, no vaccination records were immediately available to healthcare workers in some of the largest hospitals in Louisiana. Before the vaccine rollout, the FDA made it clear that these drugs were still experimental and follow-up was essential. The fact sheet for providers states, additional adverse reactions, some of which may be serious, may become apparent with more widespread use of the Pfizer vaccine. What is the duty of the provider, the person administering the shot, or the healthcare worker for whom injury is made known? VAERS is considered by most to be a passive reporting system, but legally it is mandatory for a reporting system for providers. For example, in the FDA briefing document for Pfizer, it states, providers administering the Pfizer vaccine must report to VAERS as required by the National Childhood Vaccine Injury Act. Some of the things that they are to report: vaccine administration errors, serious adverse events, irrespective of attribution to vaccination, meaning the providers do not get to determine causality, meaning LDH does not get to determine causality. That's just in the FDA briefing document. In the Pfizer fact sheet for provider, it also states the vaccination provider is responsible for mandatory reporting of the following adverse events. And again, it states serious adverse events, irrespective of attribution to vaccination. Some of those serious adverse events are defined. Death is included. Life-threatening adverse events, inpatient hospitalization, prolongation of existing hospitalization, it goes on. Also in 42 U.S. Code, this goes back to the National Childhood Vaccine Injury Act. This is a federal law. It requires that each healthcare provider and vaccine manufacturer report to the Secretary of Health certain adverse events, including death. I spoke with a coroner, and I asked him if he was seeing an increase. If you don't mind, let me finish this portion. If he was seeing an increase of persons coming through his office after administration of vaccines, and he could not tell me, and I asked him why, and he said the deceased do not report. Someone has to report for them, and legally, healthcare providers are required to do that.
Thank you. And again, I would say that LDH reports what is reported to them. And I know they're here, but if they don't know it, or if it's not reported, I don't think anybody thinks that LDH is getting facts and figures that they're not telling. But we just don't. I mean, obviously, we get to get the 800 number out. Representative Eccles is. I think that was the reason for that, ma'am.
Can I have another 3 minutes?
No.
Okay.
You know our relationship, and I certainly respect you.
I just thought I'd ask.
Yes.
But if anybody has any questions for me.
Well, now that you said that, thank you. Representative Cruz.
Thank you, Mr. Chairman. Thank you, Jill. I appreciate you both coming here to testify. Are you aware of that summary I was mentioning earlier about how many vaccine adverse events are reported in VAERS from COVID compared to all the other vaccines?
Yes.
And even if this is underreported, which many people say it's wildly underreported, do you think there's an explanation for why there's in the numbers here almost twice the number of deaths reported from COVID compared to all other vaccines from 1990 to today?
It's extremely disturbing. And we have to understand, because VAERS, a report to VAERS, does not determine causality, it is a safety signaling system. So regardless of whether or not those reports are confirmed, it should cause great concern that there's more reports in VAERS for COVID vaccinations than all other vaccines combined. And when LDH could not answer that question, VAERS was established in 1988. So it's been in place for decades. So we have more reports for vaccine reactions following COVID vaccinations than all of those decades combined for all of the other vaccines combined.
Now, you had mentioned that healthcare professionals are required to report in VAERS. What about coroners? Are they required to report in there?
They're not considered a healthcare provider. They don't provide healthcare necessarily, so they're not a mandatory reporter, which would be interesting as far as the future is concerned about what we can do for that.
Very good. Thank you. Appreciate it.
Thank you, Representative Cox.
What is your relationship? Beth, what's your relationship with LDH? I mean, have you talked with them? And
Well, I sent them the letter in March.
okay,
With our
did you call them?
No, we're not on. We're not on the,
I mean, but
we don't have that kind of relationship.
but there's numbers. Isn't there numbers for us to the world? I mean, well, I know the regular folks should be able to call too. Maybe not directly to the secretary, but to some of the other guys. You don't have that.
No, sir. We do. Like I said, we wrote the letter to them in March.
Yeah.
Whenever I send a communication to this legislative body, I usually CC Dr. Phillips or Dr. Cantor
Right.
on those. So our concerns are shared with them. We've included them on the informational and educational Zoom calls that we've invited all of you to, in which we interviewed COVID vaccine injured individuals, and they've shared their own experience as far as being reported to VAERS, the lack of reporting to VAERS, the follow up from LDH, and so we've shared all of that with them.
So you correct me if I'm wrong. You're saying that the numbers that you have are greatly different than the numbers that the state has.
Yes.
And that's for that's for reporting in the state.
In the state. Would you like the state data?
Yes.
Okay. Hang on just 1 second. Let me go through my
Through your
photos.
I believe that Dr. Cantor has already given us state data. I mean, they've asked
Okay.
already, didn't they not?
He gave the state
No.
data that he has
Representative
verified.
Eccles has that, yes. Yeah, we've got that on record already.
Dr. Cantor gave the data that the state has verified, but the actual reports that have been made by Louisiana citizens to
Right.
VAERS
Yeah.
is drastically different. And I have a screenshot from VAERS as of last Friday. VAERS is updated every Friday afternoon. So I pulled it up this past Friday and I searched specifically for Louisiana. The number of deaths in Louisiana reported to VAERS. I want to get that straight because I do not determine causality from this either. The number of reported deaths to VAERS is 62 from Louisiana residents.
yeah, and he said that. Yeah.
The number of life-threatening events, 83. Permanent disabilities is 90. Hospitalizations, 293. All told, the total number of reports is approximately, this is 115%, meaning it's greater than 100%, meaning that one report may be in two different categories, either hospitalization or an ER visit, so it may be double just a tad bit, but it's approximately 5,600 reports from Louisiana alone.
Thank you.
Thank
Thank you,
you.
Mr. Chairman.
All right. Thank you both for your testimony.
Sure, thank you.
Alicia Smith, would you come up, please? And Fiorella.
I was going to say that.
Oh.
I was just going to say, I know that she has a lot of could probably give you a lot more useful information.
Well, and she
I would-
does. I mean, she writes letters too.
Yes.
And- and
Can I,
since-
may I
yeah.
yield my time to Jill?
And if you really want to give up your time, I'll let her come back. But I'm sure you have things to say that will add to all this.
Well, I mean, I wanted to know who holds LDH responsible, who holds the doctors responsible.
This is only about reporting.
for all the reporting for that. But I would like to yield my time, if I
Okay.
could. Thank you. I appreciate it.
Thank you.
I feel like Sally Fields when she won the Oscar. You love me. You really love me. Thanks, Katie. Thank you, Representative Bagley.
You're welcome.
Do I need to introduce myself again?
The lady from the representatives Attorney General's office. I missed the question ahead. Just hold up just a second. We'll get it to you. Okay. I'm sorry. Now go ahead.
Okay, again, I'm Jill Hines, and I appreciate Katie for yielding her time. I just wanted to touch on a couple of other things real quickly. In December, the December 10th FDA briefing document, December a year ago, the briefing documents for all 3 COVID vaccines available in the U.S. specified in the event that the EUA is granted, this was prior to the granting of it, it would still be considered, these products would still be considered unapproved, and it would be under further investigation under an investigational new drug application until it is licensed under a biologics license application. So a drug under EUA is still investigational. That goes on to state that an investigational drug is the same thing as an experimental drug. That's why the reporting is so important. They don't know what these drugs, the full capability of these drugs are yet until they're introduced to a larger population.
I don't think that's ever been opposition here at this.
It has. I had to argue in education committee one time with a rep about whether these products were still experimental or not. So there was some question about it. I just want you to know it's still. So, for example, the drugs are still experimental. They're still at EUA for 16 and under or 15 and under. So the CDC just approved emergency use authorization for vaccines for children 5 to 11, one of the most vaccinated populations. From the community vaccine insert under 8.4, section 8.4, it states the safety and effectiveness of Comirnaty in individuals younger than 16 has not been established. And yet LDH just sent out a text message last week, a statewide alert.
Now remember, we're talking about reporting, and
I'm
you're
getting to it. I'm
you're
getting
moving
to it.
away.
I'm
So
getting to it.
I'm gonna get you back.
It says that 5 to 11-year-olds are now eligible for the COVID-19 vaccine. These shots are safe and effective and important to keeping your child and family safe. So LDH is making a statement that's in direct contradiction to what the manufacturer states. The manufacturer cannot claim that the product is safe and effective because it's under EUA, and yet LDH is. So until the messaging to parents and healthcare workers is aligned with the manufacturer's assertions, and until healthcare workers are educated on their reporting responsibilities, especially in that age group, I would like to ask that the shots in children in that age be halted.
Hi, I'm Fiorella Trapani. I'm co-director of Health Freedom Louisiana. I wanted to mention a couple of points. Regarding spontaneous abortion, which is a miscarriage in the first 20 weeks, there came out a study published in the New England Journal of Medicine showing that 81.9% to 91.2% of pregnant women receiving the COVID vaccine in the first 20 weeks had a miscarriage. Regarding myocarditis and pericarditis, these are CDC numbers that they published. And in the different age groups, they took what the expected numbers in those age groups and then the numbers that were observed following COVID vaccination. And depending on the age group, I'm not going to go through all the numbers, but the percent increase, we're talking from 5,500% increase to 21,200% increase following COVID vaccination.
I hate to be the bad guy here, but you're not talking about reporting now. You're
I'm
talking
getting to
about-
that, sir.
Yes, okay, well,
So my
let's go
point
right to
is,
that. Okay,
I
go
find
ahead.
it extremely unrealistic that these numbers are being reported nationally, yet in Louisiana, we are somehow the exception to the rule. And bottom line, as all the nurses and practitioners have been talking about, if you go back to a CDC-funded study that was conducted by Harvard, they found less than 1% of adverse reactions to vaccines are reported. And so all of this goes in line with that. And quite frankly, to put the burden on the healthcare providers as to why they don't know, let's be realistic. They don't know because they weren't told on purpose. If you go to all the LDH communications, I got a text message from them. I want to know how they got my number. Because I got a text message announcing, hey, the vaccine is now available to 5 to 11-year-olds. If you look at all their communications on their Facebook page, not once have they published the 800 number. But they make sure to say, hey, you can get $100 for getting your shot. It is deliberate, okay? That is the problem. They don't want those numbers. They don't want the providers to know. But you're hearing from providers, and you have a CDC-funded study that proves it all makes sense once you realize what is actually going on. And the main point is, it is deliberate, and something needs to be done. Because now, millions are already vaccinated, millions are already injured. So now we're trying to clean up the mess. So how are we going to fix this going forward?
With the number is what you're...
Yes, and I do want to make one more point. I think Dr. Cantor or something said that there's never been a big vaccine rollout. Well, in 1976, for the swine flu pandemic, they vaccinated 55 million Americans. You know, that vaccine program was halted when they hit 25 deaths. We're now at more than 17,000. Why has this not been halted? And now we're dealing with mandates. Thank you.
Thank you, ma'am. Thank you for both coming and testifying. All right, next. Oh, that's the wrong thing. Catherine Alexander and Liz Morrell. Catherine's there she comes.
My time to Jill Hines.
Ma'am?